Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Dr. Brian Lenzkes is one of the most beloved and well-respected doctors and experts in the low-carbohydrate community. Dr. Lenzkes is an internal medicine doctor based in California and Arizona who has focused much of his attention on clinical nutrition. Dr. Lenzkes received his medical degree at the University of Southern California School of Medicine. He went on to complete his internship and residency training in internal medicine at Scripps Mercy Hospital, San Diego. Dr. Lenzkes has over 20 years of medical experience and is certified by the American Board of Internal Medicine. A professional speaker in the health and wellness sphere, Dr. Lenzkes also hosts the Life's Best Medicine podcast and co-hosts the popular Low Carb MD podcast, both of which I have been absolutely honored to be hosted on. These podcasts have a total of tens of millions of downloads at this point. Wow. Dr. Brian Lenzkes has been named as one of the top doctors in San Diego for several years. Although after gaining the respect of the medical community and his patients, Dr. Lenzkes felt a void as many patients with chronic conditions became more sick and required more medications. He is someone that I am absolutely privileged to consider a dear friend. Dr. Brian Lenzkes, what an absolute honor it is to welcome you to Boundless Body Radio.
Man, thank you, Casey. I want you to do my funeral, man. Appreciate you make me sound pretty good on paper,
Dude, we tell everybody during the course of this episode, if you're feeling down on yourself, you want me to read it again, I'm happy to do that at any point. You just let me know.
Awesome. Thanks, man.
You just let me know.
Yeah, the only slight correction, the ABIM, I gave him my board certification with them, and I went with another governing body just because of politics stuff. And I'm now certified with the Society of Metabolic Health Practitioners. So
yep.
I'm happy about that one. So that's the only little changes that happened since we talked last time.
I love it, man. Yeah, that's super cool. This has been a long time coming. I've been wanting to host you on this show for a very long time. You and I met, I believe, for the first time at Keto Salt Lake in 2022, and have since crossed paths several times at many different conferences where you've been a presenter. I always love your content. And as part of what I wanted to do for this episode, I wanted to go back and check out some of your original episodes of the Low Carb MD podcast. It was so interesting to go back. I know how cringy it is to go back to like your very first episodes and listen to those again. But I have to say, it was quite interesting to listen to you and Dr. Tro, who hosts Low Carb MD podcast, and also Megan Ramos and Dr. Fung at the time. And considering like what you guys were trying to put out there at the time, and considering that like you guys are doing exactly what you wanted to do all those years ago, you're still doing it today with no ads, with no advertisement money. Like it's amazing what you guys have created. It's so cool.
Yeah, it's amazing. Obviously, Jason Fung was hugely instrumental in getting us off the ground because we had no credibility at all. We're just two docs, like talking about what we were seeing in clinic. So Jason, we asked him, I reached out to him, and Jason and I have been close behind the scenes a little bit. And I said, Jason, would you come on as a guest, like our first guest to help us launch? And he called me back and said, Brian, no, I want to collaborate with you guys. I want to help. But funny enough, he doesn't like interviewing people. He feels more comfortable being interviewed than interviewing other people. So he kind of stepped out of that. But yeah, he got us off the ground, and him and Megan and, Tro, and just, he gave us so much wisdom to start the podcast off, and it is amazing. And, even going back, I don't feel it's cringe. I think there's so much that I look back and go, man, we were on, things we talked about that we got criticism for. Now time has shown that to be true. And so I think I'm proud of those old episodes too. I still refer my patients back to those. Episode number 10 with Rob Sivas is like a gold standard. That's where he convinced us about food addiction and sugar addiction and all those kind of things. So it's amazing to see how many great guests we've had on over the years.
Yeah, for sure. I do have to say, you're right. My first episodes were very cringy. Yours were not. You guys did a great job from the outset. And you guys were calling balls and strikes way back then. I mean, I had just started to learn about low carbohydrate health because one of the people I was working with tried a ketogenic diet, and he lost a bunch of weight in these weight loss contests that we were forced to do as a company, which were terrible. But this guy got really great results on a ketogenic diet. And I remember making the decision, like, that was the last day I was going to listen to music in my car, for example. I just wanted to learn about this all the time. And I remember coming across Dr. Jason Fung's work and coming across you guys. And yeah, you guys got a lot of things right from the very beginning. It's pretty impressive.
No, I think having Jason was a big asset. He probably said, guys, you can't talk about this. This isn't going to work. And, but he was such a great mentor to us for sure. And I think Tro and I learned a lot. And it was just fun because Tro and I are so different in our temperaments and our backgrounds and everything. And, at the beginning, the funny part about the podcast is I would get hate mail saying, you're so mean to Tro, and Tro would get hate mail saying, you're mean to Brian. So whoever gravitated towards one of our personality types. It was kind of a funny dynamic because we've always gotten along great. Because people would ask me, "Do you guys actually get along?" I'm like, "We're like family, really."
I remember thinking that in some of the early episodes, it was like a good cop, bad cop kind of a thing. But knowing Dr. Tro and like getting to meet him in person, that dude, I mean, he's got a heart of gold, just like you. Like his intentions are so pure, and just because he comes across a certain way on Twitter does not mean he's like that in person. He's incredible.
Yeah, people are always amazed. They're like, just spending time with Tro, and they're amazed, like he is so different than I thought. Because he is. His persona on Twitter is so different than what he is, and part of it's the Jerry Springer, like, you know, not calling out like, and part of it's this anger of saying, look, I was given the wrong advice all these years. Now I'm trying to help people, and then you're attacking me when I'm having clinical success. And so I get it for sure. We
Yeah.
both feel that way. I'm just not as verbal as he is.
Yeah, I get it. We need that kind of personality out there, and it fits on Twitter especially. And again, knowing him in person, he's not in any way like an abrasive person. He's just calling things as they are, which I really respect. And as often happens on a lot of the podcasts I listen to, I get to know a lot of your guests. I love your episodes. Your podcast is one that I listen to every single week. It's one of the few that I keep on rotation and listen to all the time and get to meet new personalities and that kind of thing. But I don't often get to dig into either one of your stories. Like I know about you and I get to know you through the episodes, but I don't often get to hear about your own personal story. So if you wouldn't mind, tell us how you decided to get into medicine to begin with.
It's kind of random. I have no doctors in my family at all. I studied in high school as a 4.0 student. I played football and wrestled. So I had, academia and I got into UC Irvine. And I was going there and I thought, maybe I want to do something to help people. So I was thinking maybe physical therapy or, training or something like that because I enjoyed sports. And then one of my buddies said, "Hey, these guys, these doctors from USC are doing this thing called Flying Samaritans. They're going down to Mexico to medical clinic." I'm like, "Yeah, I don't really like doctors. I don't think, man. They're kind of arrogant and pompous and all this stuff." So I said, I'll go down and check it out. So I went down, and these guys were amazing. They were helping people and so kind and compassionate. They brought meds down. I saw what kind of impact they had on these little communities. I was like, wow, this is pretty cool. And one of the guys actually that really impacted me. He was from Nigeria and he came over to the US, got into USC medical school, and he didn't tell his parents what he was doing. He told his parents like, "Yeah, I'm just working as a waiter." I'm like, and he got his medical degree and went back and surprised. Like in Nigeria, you get a medical degree, that's like an amazing feat. And he put himself all the way through school and took care of all that stuff. So I just saw that and I go, these guys are just really, really cool guys. And so I said, I'm gonna apply to med school and see if I can get in. And fortunately, I got into USC also, just like those guys. And it was like never looking back. Once I got in there.
That's cool. Did you decide on any kind of specialty that you wanted to focus on, or was it always just family medicine for you?
Yeah, I didn't know. I ended up in internal medicine mostly because of mentors. I had this old doc, and you kind of learn, you pick up stuff. And this old doc, I was just a med student, and you had to rotate through people's offices. And then I went rotate through gynecology, I rotate through general surgery. I'm like, my temperament is not gonna fit these guys. In academia, they're very short tempered and very like burned out, tired, hate the world. They're getting up at 3 in the morning all the time. It's a tough career path. And then I was in this Marcus Welby office with his old doc, and he goes in, and I'm thinking, what the heck is this guy? He's not doing medicine. All he was doing was talking to the person. And like, they're carrying a conversation, laughing and, having a good old time. Then he walks out and I'm like, that was the visit. And he said, well, Brian, look, her dementia is stable and doing better. And he gave me a whole list of everything he observed just by having this little conversation with this patient, and I go, this is kind of cool. This ongoing, you get to know the family and the kids and you have an impact. And, there's such a personal ongoing, if you're a surgeon or even in the ER, well, sometimes they have frequent flyers. They're there all the time and they get to know each other. But a lot of times the person comes in, they're at their worst. And I love ER docs. Their temperament is amazing. But it's a different, like you've triaged them and you send them home. And a lot of times they never even know. But the good ER docs that I worked with would ask me like, "Hey, Brian, that patient we sent up to the ICU last week, what happened with them? I mean, how do they turn out?" And they're curious about what happens. Other docs never ask.
Interesting. Yeah, that's interesting. Knowing you and your personality, that is the perfect way that you would want to practice medicine, is getting to know people, building that kind of relationship. So what was the reality? What was it actually like to practice medicine?
Wow, I'm giving a talk this weekend on that. So I was just reliving it, in the standard practice model. Now I'm direct primary care. So it's two different worlds completely, right? So I was frustrated in the system. I loved it. I loved the patient time one-on-one. We're in the room, we're taking care of stuff. But I saw that patients were getting worse and worse. And the standard of care was throw a drug, throw another drug, and then, have them come back in 3 weeks and we'll reevaluate how the drug's working. And the patients were getting sicker and I couldn't take it. And then, of course, one of my patients walks in one day, and just to give you a flavor, I was working 16 to 18-hour days. My appointments were, 12 to 15 minutes, and maybe a annual exam I'd have 45 minutes or so with the patient. And I realized, gosh darn it, if we could just get in here and do preventive medicine, but in 15 minutes, how are you going to talk about family, drugs, alcohol, stress, sleep, all these things that we know are critically important with metabolic health? And so I started getting frustrated with that, because what I would do is, once I had one patient who lost 40 pounds. And I said, well, how'd you do it? Because I'm always trying to, and I was gaining weight and pre-diabetic at that time. And I said, how'd you do it? And he goes, you're not going to like it, doc. I did this thing called the fast diet. I go, there's no such thing as a fast diet. You have to do it slowly. Well, I'm talking about all these things. And he said, well, it worked fast for me. And I said, what'd you do? He goes, I fast on Tuesdays and Thursdays, eat 500 calories or less, no carbohydrates. I said, okay, what about the other 5 days? He said, I eat whatever I want. So I said, you having pizza and beer and that? Yeah, yeah. I said, that doesn't make any sense at all. Because if you starve yourself on Tuesday, then Wednesday you must eat twice as much to make up for it because you're hungry. He said, no, it's weird. When I fast that day, on the next day, I'm not hungry. And I'm kind of forcing myself to eat. Even though I can eat whatever I want, I don't. And I stopped eating all this like processed food, basically. And he said, I felt so much better. My joints got better and all. And so I was like, that's weird. So I go and Google, of course, and I look and I'm like, fasting, the benefits of fasting, how's it work? And then I was like, oh, come across Jason Fung, who subsequently helped us get the podcast started. And he's talking about fasting. How's it work? You're lowering your insulin. You're making yourself more insulin sensitive. So I'm like, this is crazy. What's this guy selling? And he wasn't selling anything at the end. So I said, I'm going to reach out to this doc and see what he's doing. So I reached out to him. He got right back to me. Great guy. And he said, look, the day before you put someone on insulin, their insulin is going to be the highest it's ever been. Because we think your sugars are high, we have to give you insulin to get the sugars down. But once if your insulin is not working anymore, your insulin resistance. So he explained that concept to me. And once I understood, I thought, holy cow, so I'm going to start cutting my carbs. So at that time, because I was so busy, I was having a green shake for breakfast with a bunch of carbs in it, basically, right? Then I'd have like rice cracker with a little peanut butter at lunch. I would, and a whole wheat toast, like the ADA's recommended diet, basically, right? And I'm gaining weight and my sugars are getting higher. Now I'm watching my patient getting better. So I'm like, I'm going to try what this guy did. And I start doing that and I lose like 30 pounds. My A1C normalized, everything gets better. And I was like, wow, this is just wild. So then patients started noticing, they would ask me like, doc, what are you doing? I'm like, Professor Noakes was on trial at that time, by the way. I'm like, I can't really talk about it, but this is what I'm doing, but I can't recommend it to you. But if you want to do it, this is what I'm doing. And one of my patients, I learned it from him. So this is what I'm doing. And so that patient's still my patient to this day, and he's doing fantastic. And I learned a great deal, and I started researching insulin resistance. What is metabolic health? How do the mitochondria work, and all these things that we never talk about in medicine,
Yeah.
And in 6 months, I had 11 people come off insulin. And it was incredible because I'd never seen that before. I'd hear the naturopaths and the chiropractors saying it. And I thought they were nuts because once you're on insulin, you don't come off insulin, right? It's impossible. But then I started saying, well, it is possible, right? And then I could use that with my new patients to say, we could get you off insulin if you work with me, right? And then we started doing that. And it was amazing to see that because, I'm seeing all my partners putting people on more and more drugs and my patients are coming off meds and they're happier and they're feeling better. And then we have that social visit like that old doctor that I first learned from.
Wow. It's such a sticky situation, especially back then. I think now it's a little bit easier for doctors like yourself to be able to talk about these kinds of things. And we have conferences and a lot of research and that kind of thing. But especially back then, even just a few years ago, it was a lot more challenging. So you just said that you had never really been taught about mitochondrial health and insulin resistance and that kind of thing. I love asking doctors this question. How much study did you get in college, in med school, about nutrition in particular and how it relates to health? And would you want that to increase from where it was? Or do you think if that was increased, that they would just further teach some of the bad stuff that we know today is not actually true?
Yeah, that's a tough question. It really is because I don't know. It really depends on an institution and their experience and having people like Tro come in and myself come in. Guess what? We're never asked to do grand rounds because who sponsors grand rounds at all these institutions? Pharma. So if you're talking about other methods of getting off meds, they're not really encouraged by that, you know. So right now, and this is really, I mean, when you step back for medicine, it's really a really a tough time because I will say I was naive for the most part. You know, the governing bodies pass down and they say, okay, you can't do certain things, and you okay. But as an example, the reason that ABIM that I mentioned, I am no longer a part of that organization because what happened is we all got a letter from the head of that organization say, look, and you know, I don't want to be controversial. I'm just going to say what the letter says. I'm not going to make a judgment one way or another. But this is at the very beginning when the COVID vaccine came out, and they said, if you say anything bad about the vaccine, we'll take you're unprofessional. You don't have any. Well, we were seeing some bad effects from colleagues and nurses and doctors and people that I worked with and friends of mine. So to say I can't talk about that is a violation of medical ethics because my job is to say, look, here's the risk, here's the benefit. But they were saying you can only talk about the benefit, not the risk. I'm like, that doesn't serve my patient, and that's a violation of medical ethics. And then, you know, there was one thing after another, but it turns out in 2008, uh, they passed a law saying that no doctor could take a pen from a drug rep because it would alter our prescribing habits and it would make us biased. So we couldn't take a pen from the drug reps or a cup or anything like that. But their bylaw says we could take whatever we want. Like the guys that are at the top of these things making these decisions, they said we could take, and this is actually Paul Thacker just published an article going through all this, and you think, wow. So they could take personal things, they could take money, they could, and they didn't have to disclose it. Now that's a conflict of interest, right? So if me taking a pen, if you take millions of dollars and I take a pen, and that's gonna, so you start looking at these, and it's really disheartening to see where medicine's gone, you know, and
Interesting.
bonuses for doing certain procedures, bonuses for doing this, and you're looking like, wow, if you're part of the system, it's hard, and that's why stepping out independently, I can do what I want, and I don't have to. I mean, as long as it's, you know, obviously within the realm. But I don't have insurance companies saying, look, you didn't prescribe enough drugs to this person. This person needs to be on these meds. Well, sometimes they don't need to be on those meds, but they have a stamp that says this is what. So what I'm getting at is there's a lack of critical thinking and saying, okay, let me try this with my patient and see what works. Right.
Yeah.
When we start seeing people come off insulin, you say, well, shouldn't this be the standard of care? And that's really why low carb MD started. Because I said, look, I can't be the only one. In San Diego, I was the only one doing this. And my friends are looking at me like I lost my mind. But I was like, look at the outcomes. They're coming off the blood pressure medicine. They're feeling, they're healthier. And we had data on this stuff. And so, and even the other thing that was controversial back then that we touched on episode 13 was addiction and depression and anxiety. Getting better when you get your diet right and your exercise right and all those other things. So it was really an interesting ride to see. And we started low carb MD because that we could say, look, this guy in Utah is doing, this guy's in Nebraska is doing, all these people are doing this medicine with benefit to the patient. And that's how you change the standard of care.
Yeah. Interesting. No, I remember that from the very first episode of the Low Carb MD podcast. You guys were talking about mental health. That was back in 2017, 2018 when you released your first episode. That was early days for that.
Yeah, and those are things I'm proud of. That's why when I say I look back, we're proud because one of the big things is when you're a clinician, just like you know what you're seeing that works and doesn't work. So if it's not working, you say, okay, I'm not going to keep doing what doesn't work. If they say this is the new miracle drug and we see bad outcomes, we say, okay, this isn't the new miracle drug again. And so when you sing it in clinic, and funny enough is Tro and I were both seeing the same thing. I'm like, this is unbelievable that people are coming in and their mood's better. We're treating their diabetes and their mood's getting better. But it's been in the literature forever that poorly controlled diabetics have a huge depression rate. So then the question became, well, was it they were depressed, so they stopped caring about what they were eating, and then they stopped shooting insulin, they didn't care anymore, or was it that they got high sugars and that caused the depression? And it turns out it was the high sugars that preempted the depression. So depression got worse the worse you're eating. The more you're eating carbohydrates, the more you're eating sugar, the more you're in processed food and sitting on your butt and doing nothing. And we start realizing, oh, if we put these things together, and the irony that you'll like is when we first started talking about low carb, nobody was talking about exercise. They go, just eat low carb and you lose weight. It's like, well, that's a key component for mental health, for depression, for anxiety, and all these things. And back then, the amazing thing is I got attacked for 3 days because I said that I'm seeing people's mental health getting better. I'm seeing it. I'm not making it up. This is what I'm seeing in my clinic. Maybe I'm just one in a million, but everyone else is saying the same thing that's doing this kind of medicine. So we got attacked by medical doctors saying we should have our medical license revoked for saying that nutrition has anything to do with mental health. I was like, really? So I wrote we subsequently blocked each other because he's a fairly famous pediatrician. But he, I said, so you've never had kids dropped off at your office and the mom and dad are mad because grandma took them out for ice cream and cake and they kept them out all night and they dropped them off and they're a disaster the next day. Or probably never heard anyone say they need a cup of coffee to get going or a glass of wine to calm their nerves after a hard day. If you eat hot peppers all day, you think you're not going to be in a bad mood the next day when you're on the toilet all day. So, there's some common sense stuff that you would see and you go, clearly there are some effects, of caffeine and attention deficit disorder and, all these other problems that we see. And so, not looking at it, and that's what I said to him. I said, not looking at it would be malpractice in my opinion. But you just saw at the low carb San Diego meeting a whole day, and it bled over into the next morning was on mental health and low carb and ketogenic diets.
Epic. It's just absolutely epic. Yeah, we just released an episode where me and a few of my friends who attended that conference reviewed the entire conference, and that was a main theme of what we talked about. Like that day, that Thursday of talking all about ketogenic therapies for mental health was mega. It was so good and incredible. Again, you were picking up on that from the very beginning.
Well, you see it. I mean, we know what we're seeing. Like, I'm not making up something. That's why Sean Baker was talking about with the carnivore community. And I hear someone over here talking about, I'm like, we're all kind of seeing the same thing. Is it the process? And I don't know at the time. Is it the processed food? Is it getting rid of processed food that's doing it? Is it that there's certain nutrition in fat and protein that we need in our brain? And so is it a combination of those things? Is it because when someone eats poorly, a lot of times, like most people, like people listening will say, well, yeah, I'm a stress eater, right? I get stressed now, you want to eat stuff. Well, once we get the stress better, if you're eating right and your stress gets better, do you stress eat all those carbohydrates? And a lot of times they don't. They go, no, I'm at peace. Someone like you who's grounded, you're doing your things and, enjoying life, you're not attacking people on Twitter, you're a decent guy. But some people who are agitated and angry, and I'm like, I wonder what their nutrition's like, and I wonder what their relationships are like, right? To be nasty people.
Yeah, that was the thing that stunned me when I converted from, a fairly ketogenic diet to a carnivore diet, how calm everything got in my life and how my anxiety kind of dropped out. And it was absolutely amazing. So again, when I kind of did this transition back in 2018, it was really uncomfortable for me because people were pigeonholing me because I was talking about this, and I felt really uncomfortable. They started calling me Keto Casey, and I was like that guy. You know what I mean? And I didn't want to be that guy. I wanted to be able to help everybody, but people were kind of giving me that label. But I was just a personal trainer. I'm just a nutrition coach. Like I have a piece of paper that says I know something about nutrition. Like I didn't go to school for any of this. I don't even have a college degree. You are a doctor. How uncomfortable was it for you back then to have that? I would call it like cognitive dissonance of like you're observing, you're seeing that this is working, you're deprescribing for the first time in your career. That must be astounding. Like finally having some job satisfaction in what you're doing, but it's going against everything that people are saying. What was that like?
Yeah, and I didn't answer your first question. You asked me how much education I get. Pretty much zero. They said low fat, eat a low fat diet in med school. Eat a low fat diet, fat's bad, it clogs the arteries. Other than that, did they talk about stress management? Did they talk about, it's such a, even when they said, okay, the person has diabetes. Okay, talk to him about diet and exercise. What's the recommendation? Exercise more, eat less. But what do I eat less? What kind of exercise? What like there was no guidance at all. So all these people are suffering and they're getting worse and they're trying to do what they're supposed to do because the ADA said to eat a low fat diet. So they went to a low fat. What do you eat? Carbs. You eat carbs and your sugars get worse. And then the doctor gets mad at them and says, you're not listening. Some of the greats like Dr. Unwin and, Professor Noakes and all these guys who reversed themselves because they realized like this isn't working. So if you can't, I mean, just like that old doc I told you about, he had to observe. And when I was observing people getting better, I was like, these people are getting better and they're coming off meds. So yeah, I took some heat. Well, the classic was my partner is an endocrinologist. And he called me in one day and says, Brian, what you're doing is super dangerous. I go, why? And he said, well, because your people are going to get low sugars if they don't eat sugar. I go, why are they going to get low sugars? Well, because their insulin will make their sugars go low. And I said, well, just don't give them insulin then. So I said, let's talk about it. Well, how do we base our insulin dosage for mealtime insulin? How many carbs are you eating? That's how much insulin you get. So I said, well, if the person comes to breakfast, they can't eat because they're nauseated. How much insulin do you give them? Well, you don't give them insulin. Why not? Because they're not eating. Okay, lunch, they don't eat lunch. You don't give them insulin. How about dinner? You don't give them insulin. Okay. How about if they instead of that, they have 6 eggs for breakfast? How much insulin do you give them? You don't give them insulin. Like, okay, how about they go to lunch and they have a piece of steak or a salmon? How much insulin? You don't give them insulin. Why? Because they're not eating carbs. Okay. So what's dangerous? Well, their long-acting insulin will make their sugars go low. Well, then stop the long-acting. So you're treating your drug with food. So, and it's insane. I've seen that so many times. I've had people come completely off insulin. They go to the diabetes center at a big university in San Diego, and they say, "Well, everything looks good, but you're not eating enough carbs. We're going to add in carbs, and we'll give you mealtime insulin." It's like they're off insulin. That's like saying you just quit out. You're an alcoholic and you quit drinking. Let's give you a beer with every meal. It doesn't make sense at all because you're insulin resistant because it's not working anymore, right? So once you understand that concept, you start saying, "Oh, what are we doing?" And then you can't help. It's like they always say, you can't unsee what you've seen. So I thought, okay, this person's insulin resistant. How do I know that? I have to check a fasting insulin. But I could also tell without that, if your triglycerides are really high, your HDL is really low, right? Your A1C is high. And so it's shocking, and I always have to give credit to people like Ben Bickman. He has a graph that shows, look, 10 or 15 years before you get diagnosed with type 2 diabetes, the signs are there. So no one should get diagnosed with diabetes without them having a choice of saying, let me reverse this. Yep. So that's why I was frustrated with the system, because I said, look, I met when I resigned from the HMO there and went on my own to do direct primary care. He goes, Brian, I know how much money you made last year. What's wrong? Are you having a midlife crisis? I said, no, I can't take it anymore because I'm saving your system so much money and you guys are penalizing me. You're penalizing me for ordering a fasting insulin on my patient. And that's my number one diagnostic sign that I can use to prevent further disease, because high insulin 90% of the time is associated with tons of diseases like dementia, Parkinson's, bipolar, like all these things have high insulin. You go, okay, once we lower the insulin, what happens? But how do I know without checking it? So if I check it, you guys get upset with me. And I said, look, I have 11 people we took off insulin. You know how much money that saves you? Because once you shoot insulin, you're number one for heart attacks, strokes, bypass surgery, dialysis, all these things that cost the system money. And I said, look, and we trained together. I said, look, I'm saving you a ton of money. And use that. Like, there's no, if I don't put them on a statin drug, I get penalized. But if I get them off insulin, I don't get an award for that. And I work through lunch every day because I'll put my most complicated patients before lunch, and I would just work through lunch and like spend an hour trying to educate them. The problem was 90% of the people really didn't care. They go, just give me the drug and I'll just go on with my life. But I know what's going to happen with the amputations and the sores and all that. I can't let you go down that road without really at least telling you, here's where you're going. So that's what the frustration is. And the thing that really confirmed my reason of leaving the standard system is he said, you know what, Brian, the reality is you're costing us money. And I said, how can I cost you money by preventing disease that you have to pay all this money to fix? He said, we get more money from the federal government if they get that diagnosis. So you have, because I said, look, I have 64 people at that time, and this is back in 2019. I said, I have 64 people that we prevented from getting diabetes by working with them in lifestyle. And he said, yeah, but if they get the diagnosis, we get paid more. See, they're like, wow. But that poor patient, when they want to go get life insurance, they want to, live their life, they're not going to have a long life. You go, is that what medicine is? And I'm like, I can't be part of this system anymore. It makes me crazy.
Wow. That's crazy. One of our mutual friends, Dr. Jody Nishida, just told me a story of her getting yelled at by a primary care physician because she had got this person off of insulin. And after this woman was done yelling at Jody, she was like, okay, well, why are you so upset? And it's like, well, now this person isn't coming to see me anymore. And it's like, what is your purpose as a doctor if you're not trying to help people get better? But you understand as well, that's just the way the system is. It's a business, and you have to look at it that way. Otherwise, like, you don't understand why it's set up that way.
And you just don't understand. I mean, when you look at the I was just talking to someone the other day, and it was amazing. I was at an unrelated it was a medical meeting, and somehow the topic came up. What do you do? What's metabolic health? Because my company's called Arizona Metabolic Health. And we started talking, and she said, oh, do you know Casey Means and Callie Means? And I go, oh, yeah. And she goes, I read this book, Good Energy. I'm like, oh, that's a great book. So, and we started talking a little bit, and this lady was there. And she said, wow, I can't believe you guys are talking about this stuff because my doctor just put me on a GLP-1 drug. And she said, but I'm getting a really good deal. It's $500 a month for me.
Oh, my goodness.
And I was like, $500 a month, the rest of your life. Like, if you paid me $100 a month, I can get you off all your meds. You say $400 a month and you have quality life and you don't have the side effects of the meds and all this stuff. So you look at the math and you go, well, am I doing the right thing here? And so those are the things you start thinking about. And I find it tragic because I say, how many people is like, okay, all these on a daily basis when I have new patients coming in, they're on 20 meds a lot of times, 15, 20 meds. All those meds have side effects and problems. Like, okay, we forgot about the root cause. Why do you have high blood pressure? It's not natural to have high blood pressure, right? most of the time, 90% of the time, you're going to have a high insulin level, you're going to have high triglycerides, all these things that are metabolic. And so it's frustrating because if we intervene and we fix those things, then you don't need the dang drug for the rest of your life. But
Wow.
doctors are afraid not to give drugs because if they don't give a drug and someone has a heart attack, they say, well, you didn't give the drug and that's why that happened, rather than focusing on lifestyle and stress and sleep and getting out in the sun and grounding. By the
Wow.
way, I have to tell you, what I don't recommend grounding is I was mountain biking on Sunday and I combined mountain biking and grounding and it wasn't that much fun. Yeah.
You always want to keep the rubber side down when you're doing mountain biking.
Yeah,
Rubber
figure
side
that
down
out.
didn't happen.
The worst was, and she'll tell you, my wife was with me, and we went on these a little more complicated for her because she's new, and then on the way back, we are going on this big road, and I thought, I'm just gonna cross over to the other side so that it'll be an easier path for her. It looked a little easier coming up, and I hit sand and rock, and boom, over the handlebars,
Oh
and
man.
costochondritis and all the fun stuff. But anyways, I'm still in one piece.
Yeah, good stuff. Good to see you survive that one. Okay, so something stands out as you were explaining insulin and why we need it. Something stands out that Gary Taubes told me that I'll never forget. I thought this was a really good way to say it, and I'm just paraphrasing here. But he had a friend who, as an adult, was diagnosed as a type 1 diabetic, and the doctor was explaining to him, like, okay, so you're going to eat the carbohydrates and you're going to take the insulin as the antidote. And the guy is just a good-natured guy and was just curious. He said, okay, so you're telling me the carbohydrates are now a poison to me, and so I should eat the poison and then take the antidote. Why don't I just not eat the poison? And the doctor pushed back on him. He's like, well, you're not really going to want to live your life without eating this poison. The guy's like, well, I can go my whole life without eating carbohydrates. Why do I have to eat the poison and then take the antidote? It's so interesting to meet doctors like yourself and Tro and people that are asking those questions that a lot of these other doctors are not even considering. You know what I mean?
Yeah, we've lost our common sense. That's the problem. And you look at it and you go, okay, I'm telling you, I've been so blessed to know so many people that, Ira Cummins, he's the first person I heard talking about coronary calcium scores and fasting insulin levels, right? And this goes way back, to history. I mean, he's done his research. And so he showed me studies showing, like in Colombia, the number one predictor of dying of a heart attack or a stroke or having a heart attack and stroke and being hospitalized was high insulin level, by far, not even close. It was like a 70% increased risk. So I started looking at that going, because for instance, an example of something I saw, I had a patient who was coming to me, it was, A1C of 6.8, which is in the diabetic range, morbid obesity, all these other health problems. So the cardiologist is a good friend of mine. The guy already has like 3 or 4 stents in his heart and his insulin level is like 58 despite his. So I'm like, look, man, you got to cut your carbs. How do I do that? We had a long discussion. And the cardiologist calls me that day, goes, did you tell our patient, that to eat more fat and less carb? I go, yeah. How could you possibly do that? He always has 4 stents. You're putting yourself at risk. I go, yeah. His biggest risk factor is high insulin, like 58 or whatever it is. We got to lower that down. And so we had a nice discussion. We're cordial and he respects me and we had a good discussion. And so 6 weeks later, he goes back and follows up with the patient goes and follows up with him. His cholesterol got better. His blood counts got better. His triglycerides dropped. His A1C was in a good range. Everything was at better. He lost weight. And so his blood pressure was on the lower end. So he stopped 2 blood pressure medicines, 1 of the diabetes, all this stuff. And so in his note, he wrote me, he says, oh, patient lost weight, so his stuff got better. I said, it's not because he lost weight. It's because his insulin lowered. Look at his insulin level now. So this insulin resistance is a huge thing. It's not the weight. I'm telling you. I mean, I have patients in my practice who are over 300 pounds that have normal labs and normal metabolic because they're storing it all subcutaneously. It depends where you're storing that fat too. It's not just about weight loss, because if that same guy would have put on 10 pounds of muscle, would it be not a success? And so all these things we look at, and it all ties back to metabolic health. Ultimately, that's what you talk about, your mental health, you talk about Parkinson's, so many of these things. Obviously, there's some diseases that, are going to happen whether you're metabolically healthy or not, but your odds are way better. I mean, you can get hit by lightning, but your odds are better if you're not outside in the rainstorm with holding a metal rod.
That makes me think of Caddyshack.
Yeah, Caddyshack. Yeah.
Rat farts. If you're hearing this for the first time, this would all sound so astounding, but it's also so common sense that we have this diet that, like, it doesn't work for everybody. We're kind of in this habit of saying like, we can't recommend this for everybody and everybody needs to individualize. But at the same time, it's like if you're in this general space, it seems to work for a lot of different things for pretty much everybody who tries it. So it does logically kind of make sense. Although again, the first time you're hearing this, it might sound completely nuts. But if again, like do what you do, step back, ask questions, it makes so much sense.
Well, and I think that's why they have to have someone like you, because you have to pull levers. You have to pull levers at sometimes. You may start out like if your A1C is really high and your insulin's really high, you may have to start on a higher fat, and then you use that as a lever and get that down in your diet, right? And because it just depends where you're at metabolically. So a guy like you, if you eat carbs, like, okay, it's a different situation than I have a diabetic who's 350 pounds and their sugars are 200 and their insulin's out of whack and everything's crazy. Like they're the person, like you said, if you have a certain poison, you don't take the poison, that's the problem. So if you're allergic to pecans, I don't say, well, eat pecans and I'll give you steroids every day. So you just don't eat the pecans, eat something else. Eat peanuts if they don't make you sick or whatever. So I think it's that where the hard thing is they can't step out of like doctors. I'll tell you, like, the joke is like doctors want to fly under the radar. You want to be in the middle. If you're a pack of sheep, you want to be right in the middle, because then you don't get eaten by the wolves who may be out to get us. So there's safety in being in the middle. But people like Professor Noakes and Gary Fettke, they stepped outside and they went on their own and said, wait, this pack is going the wrong way. We gotta change the direction of the pack, right? So it's such a hard thing in medicine, because that's our mindset, is not to rock the boat. So people just say, that's what I was told. So for instance, going back to the discussion I had with my endocrinologist ex-partner there, and I said, okay, let's go back. We both collect old textbooks. How do they treat it before 1921? How do you treat type 2 diabetes? Well, they didn't know it was type 2 back then, but how do you treat diabetes? Diabetes would just mean you're peeing out a bunch of sugar. Well, initially, way back in the day, they said, well, if they're peeing out all the sugar, they must have low sugar, so we'll give them more, because they didn't do blood tests back then. They would just give them more sugar and they all died, right? That wasn't the answer. And then what they did is they said, well, let's try just giving them meat and see what happens. Let's cut down the stuff that breaks down the sugar. And they got better. That was the standard of care. But again, in 1921, we get insulin, go, okay, just give people insulin. But we learned subsequently that people on higher dose of insulin have way more peripheral vascular disease. All these complications that we're seeing is like, so there was actually an Accord trial. I don't know when it came out. I was in it had to be in the 1990s. And it said, don't control diabetics too tightly, because if you do, they have an increased all-cause mortality, stroke, heart attack risk, and all this stuff. So now the A1C is supposed to be at 7, which is a total disaster.
That's crazy.
But how did you lower the insulin? I mean, the sugars, they were using insulin and these high-powered drugs. So it was the side effects of the drugs that were causing the increased mortality. Because if you do it with lifestyle, you're not getting hypoglycemia. You're not getting these low sugars that cause a problem, right? Because your body takes care of itself, and it's amazing the more you understand physiology. And I think there's just a lack of understanding of physiology, and doctors are so busy, they don't have time to really go back and look and understand basic physiology. When you understand that, someone like Jason Fung, he says, wait a minute, let me explain a way where you can understand. Then you could help a lot of people.
Yeah, definitely. Well, speaking of helping a lot of people, you started the podcast, a low carb MD podcast, with Dr. Tro, who also had his own journey of weight loss and discovering this work. What was the story of the two of you kind of combining together to start that podcast?
Well, funny enough, I was doing it's amazing how life works, man. This is why I'm so like, I laugh and go, how did this happen? But I'm at my chiropractor's office one day, and the receptionist there goes, hey doc, I know you're into like, health, lifestyle and all that kind of stuff. What do you think of this? I love this. This is my cardiologist. I love his book. And I'm like, I'm probably not going to like it. Probably not going to like it, because I know what he's going to say, low fat, vegan diet and all this stuff. And I'm probably not going to agree, but I'll take a look at it if you really like the guy. So I pick up the book, and it's Brett Scher. And I'm like, Brett Scher, we trained together at Mercy Hospital. At that time, he was more on the vegan side and all that. Well, Brett Scher is one of the most respected cardiologists. He's a voice of reason. Now he's doing metabolic mind, and so he's realizing the benefits of metabolic health. So anyways, I thought that's funny. So I reached out to him. I go, hey, I really feel like I want to do something at a church or a big community where we can just help people with low carb and keto and just get people on track and just do an education. Would you volunteer? So he volunteered with me. I had a nutritionist, him, me, and an exercise guy. We went and talked to a church. But I wanted there to be a lot of people there, so it's not a waste of their time. So I reached out to the two keto dudes, which was one of the low carb podcasts back in the day. And they said, hey, why don't you just, because I wanted to advertise on their thing. And they go, are you selling ketones? I said, no, I'm not selling ketones. I just want to do education. And they go, why don't you come on the podcast and talk about it? So I come on the podcast and they said, we don't have any doctors who are doing a podcast on this stuff. Why don't you do your own podcast? I was like, yeah, I don't think so. I don't have I'm not of that temperament, because I was getting people like, I'm going to listen to this guy for 2 hours, like, or an hour at a time, whatever. So I thought I need to so I was looking around on social media. And I was like, there's got to be someone who's like that we can do it together. And like they'll be like maybe have a little different personality or perspective, and really discuss these matters, right? And dive into it. And so I see Tro, and at first I'm like, oh, this guy's a hothead, and he's telling people to where they can go and all that kind of stuff. But then I saw a post he did, after, and his story was amazing already. He used to be 350 pounds. Now he's like 200 pounds. That was 150 pounds, sustained it for 8 or 10 years now, or 12 years, maybe 15 years, whatever. And that's unusual. So I'm like, I want to reach out to this guy and just talk to him. But I saw he posted something, and it was really impactful because he said he was running on the treadmill after he lost his weight, and he's normal weight. He's running on the treadmill, and these two guys behind him are going, look at that fat guy. Why is he even here? He's wasting his time. He's like, he's a waste of space. And he got embarrassed, and he got off the treadmill to leave. And then he realized, oh, they're not talking about me. They're talking about the guy next to me. But when he had that emotion that he still gets it, and he talks about having to put on seat extenders and what life was like, I was like, man, I want this guy on the podcast. So I called him. I go, look, I would love to do a pod, like if you're interested. I mean, but we're putting ourselves at risk because it's not the standard of care right now. So people don't like that. And that's when we reached out to Jason to see if we could do our first episode. Yeah, because then they said anyone who talked about keto was quacks. So we were actually going to call it two keto quacks as the start. And Jason's like, no, you're going to lose credibility doing that. Like, but we're like, we just thought it was funny. So Tro and I got overruled by Jason. That's how Low Carb MD came out.
That's amazing. I actually didn't know that story. That's great. I knew this story about Tro and how personally he took it with people. He thought that people were talking about him after he had lost all the weight, and how that kind of stigma continues. But I didn't know how the podcast started. I love that. You mentioned things like food addiction, learning about carnivore diets. What other things surprised you about this journey with podcasting and interviewing all these other experts? Was it validating for you at the time to find so many other people out there that were kind of finding the same thing about the same time that you were?
Yeah, I think they, really I looked at it as like saying how many docs out there, practitioners, PAs are out there that understand it and what's happening to them, and like you, I love that you asked the backstory, because I started the other podcast, Life's Best Medicine, to talk about Jason. What do you do for fun? What motivates you? What do you like as a person, not just the science, right? So I think, it was just amazing. It was amazing just to sit down with Professor Noakes, Gary Fettke, Belinda Betke, Dr. Unwin, all these people, and just talk to them as human beings. And that's the thing is, if you go to a standard medical conference, the speakers will fly, they get flown in, they get wined and dined and all this stuff. They give their lecture, they leave. They don't sit and go, hey, Brian, what are you seeing in clinic? Right. So Dr. Unwin, who's a genius, would say, Brian, what are you seeing? What's working? What's not working? Tro will say, Brian, what's working? What's not working? And so when people have a genuine curiosity to help people, you get the arrogance out of the way, because people are arrogant and they go, this is what I've always said. So they won't change even if it's not working, they'll stick to that. You got to eat 6 times a day. You have to eat carbs with every meal. You got to, and it's like, it's not working, right? Especially when we got a continuous glucose monitor. That was a game changer with the movie Fat Fiction.
I was going to ask you about that.
Yeah, to show. And I'll tell you, one of the things, and I got to reach out to those guys. But one of the amazing things about that was, we were talking about reversing disease, diabetes, obesity, hypertension, those kind of things. But the amazing thing is, it was one of the best days of my career, is they said, doctor, you shut up and go sit in the back. We're going to interview your patients. Don't bias them. I'm like, okay. So they start talking. They have 5 of my patients up there. Anyone who saw the movie will remember that. And they're all talking about reversing diabetes. And one lady said, you know what? Getting my sugars better, losing weight, all those things were great. But my mood and my anxiety got so much better. And she started crying. And she said, it was like I was in a fog my entire life. And I've known her. I've taken care of her for a long time. And she said, I was in a fog, and all of a sudden the fog opened and I could see the birds singing. And I started like spend time with my neighbors, and I started cleaning my house, and I never had energy to do that. And she said, my energy got better, my focus, I was laughing again. And the guy next to her said, me too. And then me too, all of them. So I'm understanding, but at the time it was too controversial. So they cut it out of the movie because it wasn't about mood. It was about diabetes, which is our number one killer. But when you see that, I go, wow, how many people are walking around depressed and anxious, and it's their constant sugar shifts and stress and not sleeping and being uncomfortable or having poor self-esteem, all those things. You think, gosh darn it, if we can intervene there. And that's what we do in our private practice, right? And we see it. We see people's mood get better. Like people aren't. Well, actually, now people are with bipolar and schizophrenia are reaching out to me, and it's amazing because I have a confidence now because I've seen the studies. I know what we can do. And so, as a matter of fact, just as a quick aside, there's a guy that I just interviewed, and I would love to connect you with him. And you may have met him at the conference. His name's Jules,
I remember
and
him. Yeah.
yeah, so he got up and he's still on his journey, and he asked a question. He said, "Look, I've been going through a long history of rapidly shifting bipolar disorder, and last 2 years I've been in remission and haven't had any, and I've had major life stress, and I've been and so basically his question was, what supplements do you recommend for people to assist them when they're on a low carb ketogenic diet and they have bipolar or schizophrenia? What supplements? And the doctors were kind of like, you could just try this, you could try that. We haven't seen anything that's that great. Anyways, the next day I ran into him in the morning. I have my coffee and I go, hey, I wanted to thank you for saying something because I know you're a young guy and it's embarrassing talking about mental health in front of a big group of people. And he looks at me and said, can I give you a hug? I said, give me a hug? Sure. Why do you want to give me a hug? No one else wants to. Everyone else tries to get away from me, but you want to give me a hug? He said, you saved my life. He said, you and Tro saved my life. And I'm like, really? He said, yeah. He goes, I was rolled up in a ball, depressed, 450 pounds. And someone recommended your podcast, Low Carb MD, and I listened to you interview someone who had bipolar. He said, I listened to it 15 times because I couldn't believe what I was hearing. And within 2 weeks, I was 80% better, right? I went, cut out all the processed food and sugar. And you go, holy cow. And I interviewed him on Life's Best Medicine. It is this guy's brilliant and it's astounding. But you go, wow, that's way better than losing a few pounds and getting like to be totally depressed and thinking about how you're going to kill yourself, and then having hope because you hear someone else talking about it. That's what you're doing with your podcast, is giving people hope that they can get better, that they're not going to be miserable in the rest of their life in this depressive state or manic state. And it's amazing. That's probably the most surprising thing that I've seen is the mental health benefits. And that's why Metabolic Mind, when I heard about Dr. Palmer, I thought this guy's nuts. He's treating schizophrenia with a ketogenic diet. Like, what's the connection? And so I interviewed him, and that was I got to interview him on Low Carb MD. I was like, well, how do you even think about this stuff? And because I was seeing depression, anxiety, but this is like little baby stuff compared to like major stuff like schizophrenia. And he says, what do you treat schizophrenia with? All the drugs that we use for seizure disorder. What was for seizure disorder? Ketogenic diet. He said, I thought worst case scenario, they lose weight and they have a better life than being 450 pounds. At least they'll look a little bit more normal because all those antipsychotic drugs cause massive weight gain, hundreds of pounds. Jules said that too. He was 170 pounds, and he went on antipsychotic medicines, and he ballooned up to 450 pounds. So you start looking at these things, and you go, oh, gosh, it's pretty amazing if it is. And you go, what if? Like right now, we're seeing huge epidemics of OCD in grade schools, and attention deficit disorder, depression, anxiety, violence, and all that. And we have data on this stuff. So how can it be dangerous to intervene and say, let's eat healthy diet like our great grandparents did? Right. Let's change. We didn't have all the processed food and all that. Why don't we at least start with that and cut it out? Then if you want to go to one end of the spectrum, you can, or you can go to the other end of the spectrum if you want. But I think if we can just make that one change of cutting out soda, right? Drastic, huge benefits. And so, yeah, I think it's just, I don't even know what your original question is. Sorry for going on a tirade, but yeah, I just want people to know that, man, if you're depressed and anxious, like make a change. You can't keep doing what you're doing. You got to make a change.
And huge shout out to Jules. It was so cool to meet him at San Diego and hear his story. And yeah, very much looking forward to that episode on your show as well. You mentioned Fat Fiction, one of my favorite documentaries about this. The timing was just so unfortunate. I was at Low Carb Denver 2020, the weekend that the world was shutting down. They premiered the film the first time. They were getting people to you can host this, you can, rent out a movie theater or, at your house and invite people and do these screenings. It was like, yeah, that did not happen in 2020. But it was so cool to watch that documentary, and you featured predominantly in that documentary, which is great. The experiment, it was so legendary. Like the experiment where you had the people, they were going on, the ketogenic diets and using continuous glucose monitors, and they would do a week on the diet, and then they'd have to shift back to go back to a standard American diet for a week, and they were utterly miserable. That was so fun to watch that contrast.
It's amazing. And that's like that's why all those years you start seeing it. And as doctors were skeptical, and we go, "You're not listening to me. You're not listening." Like get like for instance, someone I put them on insulin. Well, insulin alone is going to make you gain 15 or 20 pounds. Like you go on insulin, you gain weight. That's just the way it is, right? It blocks fat metabolism, makes you store fat. So when you start shooting people with a bunch of insulin, it gets worse. So that's that's the problem we get into. And trust me, one of the other endocrinologists in town, who's a nice guy, but his answer, his hammer was insulin for everything. Insulin, insulin, you need more insulin. So these people are on massive doses of insulin to keep their sugars under control. But he never talked about diet. Never talked about diet. He never said, "Hey, why don't you cut the soda out? Why don't you cut?" So I would tell my patients, "Look, I know you're seeing him, but I'm telling you, every soda you drink, you got to shoot X number of units of insulin just to get rid of that one soda. Just don't drink that soda. You can take less insulin, get more insulin sensitive." But what happens is they got massively insulin resistance. So you need to shoot more and more and more and more insulin. So these people are on massive doses, and you know what the outcome is going to be. It's a disaster. So you go, well, if I can intervene and just educate you a little bit and get you walking, put on a little muscle mass, all these things make you more insulin sensitive. I think, the great one, Ben Bigman, talks about that. At least 5 things you can do to get your insulin lower, right? Watch your stress, get enough sleep, don't hate the world, those kind of things, exercise regularly, don't smoke or drink to excess, and eat real food. Those are the 5 things you have control over. So for medicine not to talk about those things, it's a total disaster waiting to happen, because all we're going to do is manage disease until we get to the root cause of why we're having these diseases.
Yeah. Yeah. I love that. I love that approach. It's one thing to decide to do this on your own and do this for yourself and start your own practice or whatever. But also you have to keep in mind that you're doing this as a family, and your wife also, is going on this journey with you. And, it was awesome to be able to chat with her a little bit at the conference that we were at and kind of get her side of the story. I always find it interesting to not only talk to like Dr. Tro, but also talk to Rosette. Like, how was it for you to be in that position? Or, talking to Robin Dobbins about her bipolar, and also talking to her husband, Matt, about what was it like for you? Like, now your wife doesn't have bipolar seemingly, but now she has super high cholesterol. That's really uncomfortable. How do you feel about that? And so I want to know, like, what was it like for you to take that step to open your own practice, not only just for yourself, but like your wife, your loved ones? Like, talking to her, it sounds like she was pretty much ride or die regardless. She was going to go with you on this journey, just like she went with you on the mountain biking trip where you couldn't keep the rubber side down. But like, what was it like for you to take that step to open your own thing? That must have been challenging.
Yeah, it was I would say it's a step of faith, right? You go, look, and the craziest part was I just realized like it was killing me. I'm like, look, if I'm gonna talk, like, I'm a hypocrite to a degree if I'm talking about healthy lifestyle. As a matter of fact, how life works is amazing. I was at low-carb Boca to speak, and at that time I was just working my tail off. I was working like crazy just to be able to go to this conference. And the conference, I flew in on Friday, so I was off Friday and Monday, Friday, Saturday, Sunday, the weekend. So Friday and Monday I was out of the office, and I came back and it was a total disaster. Like, I was booked solid, and I was thinking, like, this is crazy. It was like being a pilot and your whole plane's full and there's like 20 more people to get on your plane. You're like, how am I going to get all these people in? They want to be seen. And so I come in, my medical assistant's crying on Tuesday morning, and I said, "What's wrong?" She goes, "Your patients are," I can't say the word she said, but not complimentary. I go, "What?" She goes, "I've been yelled at for 2 days since you weren't here." And I was like, "Really? Why?" Because the other doctors were too busy, and they said send them to the ER. So they were going to the ER and for a cold or whatever it was. So they were mad, and I get it. And so I'm dealing with that. But I was booked solid. So I worked. I was getting home at like on Tuesday. I got home at 11:30 at night,
Oh my gosh.
and I was back at 4 in the morning, out back to the hospital again and back to the office, trying to catch up on all the labs and paperwork and all that. I'm like, I was only gone for 2 days. I was only gone for 2 days, but I had 2,000 patients at the time. So how am I gonna take care of all those patients and do everything I have to do? And like work, she goes, "You're booked through lunch, you're booked through dinner every single day, starting at 7 in the morning, seeing patients, and you have no breaks for like 3 weeks already." I was like, and I have 12 people who want to be seen on top of that. Like, what do you want me to do with them? I was like, man, this is brutal. So I went and to talk to my one of my partners, and I go, look, this is unsustainable. I need to have a nurse practitioner or a PA, someone to help me, because I cannot take care of 2,000 patients adequately, especially if I want to do education with them. So my bet was, if I spend an hour with you and work through lunch, if I can convince you, you're going to be a healthier patient, and you're not going to be coming in every 3 weeks. You're going to come in once a year for your annual exam and be healthy and fit and good. And I'm like, why does the medical system not see this? It's an upfront cost of education that we have to educate people so they know what to do. And so that was when, and I was like, so I went in and talked to my partner. I go, and it would happen to be 2020, right before we knew COVID was coming in January. Kobe Bryant had just died that weekend.
Oh, wow.
And I walked in and go, look, if I can't, and I knew my contract was up in June. I go, look, I'm not going to renew my contract if we can't come to a conclusion. I need a full-time PA to help me, tell me dig out. I can't do it on my own. So he said, no, we don't have room. We're not going to do it. And I said, okay, then I'm going to give my notice, because I can't deal. He goes, do you know how much money you made last year? It was the same thing the head of the HMO made. You made a lot of money. I go, yeah, it's not the money. I can have money, but I can't spend it because I work all weekend catching up from the week before and getting ready for the next week. I can't go to my kids' swim meet without being frustrated because I got so much to do. So I'm like, this is the lifestyle. It's like, I know those big 5 things. And I just met Ben Bickman. He told me these 5 things. I go, stress and sleep are huge out of this. It's not just eating low carb and keto. So I'm like, oh, that's a big part of this equation. I got to address that. So ultimately, I said, Kobe Bryant, he would have given up every dime he had to spend 2 more days with his family,
Mm.
right? It wasn't about the money. It's about spending time and being there and being connected. Human connection is huge for metabolic health too, right? We learned all that during the lockdowns, and we got separated, and we no sun exposure, no exercise, stressing out all day, not sleeping. So I said, we can't do it. So I walked out of the office, and he goes, oh, and he said, okay, then start looking. I go, okay, I'll start looking. Right. And the next day he said, oh, come on, Brian, we were heated. Everything's fine. Like, you're not going to leave. I go, no, I'm done. I'm done. Cause I talked to my wife, and she said, Brian, get out. There was a lot more factors involved, but just get out. Like I said, it's going to be a struggle, but crazy how life works. In 2011, we had a big embezzlement. Our office manager at the time embezzled $500,000 from the practice. So I didn't get a paycheck for 2 months. And
Oh
she
my
said, you know
goodness.
what? You didn't get a paycheck for 2 months, and we survived it. I believe in you. I think this is something that's going to be good. So let's get out. So I called a buddy of mine who happened to be a builder. I go, do you have any office space for me? I just need a little tiny office because I know I don't need this huge overhead. And he said, I got a place for you. And it's on the campus. The campus, it was about 3 minutes from my house. And it was amazing how it all worked out. So yeah, my wife was so supportive, but it was kind of like, as a matter of fact, it was funny. It was an act of faith in a way where you say, look, I walked into my office, and I was imagining like, okay, you're standing on the edge of a cliff, right? And God's saying, look, take the step, and I'll put dirt under your feet, or I'll put a bridge under your feet. But you have to have that courage to take that first step, and it's scary. So my vision was like, you stay on the track and you keep going forward, and your path's gonna lead you there, right? So that's how it worked out. San Diego metabolic health. It was low carb MD, actually. I called it initially, and then because of the podcast, and then I was like, I'm not just low carb, it's metabolic health. It's really about that whole approach, stress, sleep, all those things. Because you can't just be low carb and think you're there. And so people say, I tried low carb, it didn't work. How was your life? How was your stress? Were you enjoying yourself? How was your spiritual health? How was your job? Were you sleeping? All those things are factors in this. And if you want to lower your insulin, it's not just you go, I'll eat this way and I'll be great. There's a lot more to it. Exercise, activity, putting on muscle mass. All these things are huge. And so um, that's why I went. So I never looked back, never looked back. And even now I just look back to remind myself that so much happier.
That's amazing. Would you call it a success based on whatever metric you would use to define success? Would you call it a success at this point?
Oh, absolutely. Just success. Even if you go, okay, let's not even look at the finances. Let's look at, a great question. My neighbors, they would tease me before when I was in my old job because I would leave in the dark and I come home in the dark. And they would say, why do you even wash your car? No one ever sees it. It's never at your house. So I never got together with my neighbors. I mean, rarely on the weekends or something, but during the week, forget it, man. I was too busy. So if someone wanted to meet me for lunch, I never left the office for lunch ever, like maybe twice in 20 years because
Wow.
I didn't have time. Okay, if I take a lunch break with my buddy, I'm gonna be working until 8 or 10 that night again, and then like it's not worth it. So if I wanted to take time off, it wasn't worth. I was stressed. I do volunteer work every year in Guatemala, El Salvador, Vietnam, and I would be stressed for a month before and 2 months after because I had to take care of the patients. And the reason I was making more money is because I was taking care of patients. I was working late. I didn't want to. If I could change and say, I'll take a financial hit and not work as much, I would have taken it in a second. That's why I wanted the PA. I'll take it in a second. It's never been about the money for me. I want to have security, but you want to enjoy your life too and be able to say, I'm going to take a vacation for a few days. Now I go from 2,000 patients to 400 patients. Guess what? I'm just thinking about doing physicals on 2,000 patients every year. Like
Oh my
you'd have to
goodness.
schedule now a year in advance. Now I can say, hey, you want a physical this week? I can get you in. Like you want to talk today after work? I got time.
Mm.
So time, and I have time for the patient to research if they have a new disease. And I can say, let me research. I don't know much about that. Let me research it. Let me look at the expert. As a matter of fact, doing the podcast, I can call people and go, hey, Ben, what do you think about this? Hey, have you seen this before? Right. And to see how much we can help people. For me, the success is my patients come in and they're happy. Like hearing that from Jules, you go, and in Boca before all this happened, I was there and Rob Sivas gave a great talk, and I'm like, he's full of it. He's not working on mindfulness, and like Rob is a super intense guy. And I said, Rob, did you really work on like these things and meditate for a week? I can't imagine you just slowing down. And he said it was life changing to be able to take a breath and just breathe and not be angry all the time and throw your instrument on the ground and be a jerk, right? Take a breath. If you could sit there for 24 hours and do nothing. And the funny thing was, I was sitting there while he was giving this talk, and I was sitting next to another doctor. And I was like getting stressed because he was sitting there for 3 days and accomplishing nothing. I'm like, if I did that, and this is premonition was coming the next day when I got home. It was like, you can't just sit there and do nothing because everything's going to be piling up and piling up all those calls and messages and labs and all that. You're never going to catch up. You got to keep grinding and grinding. But how long do you grind for? When do you slow down? And while Rob and I are having this conversation, I turn around, there's these three people standing there. I'm like, oh my gosh, I'm so sorry. I'm having dinner with Rob in like an hour. Like we were just talking. I just got, and she said, no, we're waiting to talk to you. And I hadn't talked yet. And no one knew who I was really at that time, right? Back in 2019, when the conference was. And she said, no, you saved my life. And I was like, do you know who I am? She goes, yeah, low carb MD, right? I said, yeah. She said, I'm from Mexico City. I started listening to you in Tro, and I started doing what you said. She goes, I lost 58 pounds. I came off all my insulin, all my blood pressure. And I'm like, so when I was thinking I could reach more people on the podcast than I can in my office. If I see 20 people a day or 25 people a day, and only about 10% are listening to me, how much more powerful are we doing the podcast? We could reach way more people, right? And people in other countries that we'll never ever go to, and it's amazing. You realize like what you're doing here is so important because you're reaching people that maybe that's the only time they're going to hear about this is hearing you, right? Because they like you, whatever. And so those kind of things are so powerful. And you start looking, it's like I can help a lot of people. So I said, look, and it's crazy because and I've been bad at it lately. I got to get back to it, but I was journaling at the time. I said, wouldn't it be awesome if we can have like if I could have all my patients and do a Zoom meeting with them and just talk about staying on track, low carb, exercise, stress, sleep, and just talk to 30 people or 50 people or 100 people at one time instead of because my medical assistant would say, Doctor, do you realize you say the same thing over and over all day long? I'm like, yeah,
Right.
I do. And it's a waste of everyone's time. If I could just get everyone together and go, look, you all got diagnosed with diabetes this week. Let me educate you all at one time because the limiting reagent was my time, right? Now in what I'm doing now, every 2 weeks we have a Zoom meeting and we all get together. Whoever wants to come comes and we talk about whatever. Are you stressed? You're having a bad week? Have a guest on talking about food addiction, whatever it might be. And it's such a value. And then generally now it's getting time again. We'll every other week we'll do a walk with the doc and we all go for a walk and talk about life and people let their guard down. People build relationships. A lot of people are lonely and sad and they don't have a lot going on. So now I have ladies who will go walk every week together and they're getting better. So it's as bringing this community, well, like the importance of community and hope and things in medicine we've lost sight of. It's incredible. Like we don't talk about those things. You say, okay, here's your drug, see you in 3 weeks. We'll check your blood pressure again. you know?
That's amazing. Your work is so incredible and inspiring. And I've heard you ask this question many, many times. I'm going to ask you now, what is life's best medicine for you?
Wow. Wow. You're turning
Still
it,
your
you're turning
signature
it around on
question.
me. You're stealing my stuff, man.
Exactly.
Yeah. And that's why I started Life's Best Medicine. Cause like I say, Jason Fung, what's Life's Best Medicine, all these people. And I think Life's Best Medicine is for me really walking in faith, saying, look, I'm not perfect. I got issues, I got stuff, but saying, let me do the best I can. Let me see how many people I can help because ultimately, I think, when you're on your deathbed, you go, what matters? Do people say, what kind of car do you drive? Well, and a good friend of mine, and it stuck with me. And it's because he's a attention deficit. He's a pastor, but he's all over the place. And he goes, Brian, sitting there at, on the beach one day, and he goes, Brian, it's all about the potato salad. I go, what are you talking about, man? What do you mean the potato salad? He said, well, I do a lot of funerals and, celebration of life. And for some reason, they always go back to Aunt Betty's house or a family member's house and they eat potato salad. I don't know why they have potato salad, but they do. Generally, whenever I go, they have potato salad. And people are eating their potato salad and they'll go, what, either you lived your life and you helped so many people. And like that day I was devastated you came and helped me, or you watch out for me that day when I needed a friend. Or they're going to say, what a waste you were. You could have done so much potential, but you never did. So it's all about the potato salad. And I would say that's a huge thing. It's really about what impact we leave behind. And I think spending time with family and friends and nurturing relationships, because we're built for that. And I think if I can help patients to live better lives, to have more rewarding lives and more fulfilling lives, and if they enjoy working out the gym, if they don't like the gym, go for a walk in the wilderness or ride your mountain bike, whatever you're gonna do, find your passion in life. And that's the thing is that struck me when I started doing my metabolic health stuff. One of the questions I would ask people is like, what do you do for fun? And people say, fun? I'm trying to survive. So many people didn't have an answer for that. And I was like, man, I don't want to have that answer. And I think working in the job I was working, and it became a job, right? Not a calling. So now I'm in my calling and I'm in my place where I can help. You come in stressed or tense, you just got diagnosed with diabetes. I'm like, okay, we can work on this. So it's like I have hope because I've seen it before. I know what we can do. And so being able to give hope to people, and you have people come in stressed and tense and worried and they leave with a smile, they're like, that's a gift. That's a huge gift. And for me, those kind of things are reaching out. I do volunteer work and it keeps me grounded. And I go and, you go to El Salvador or Vietnam, and you realize these people have nothing, right? And what I learned is that most of them are very happy, and we have everything and we're not happy. So I think it's really about contentment, being appreciative, counting your blessings. And I would say, for me, I'm just so fortunate. I look at that, and all the people like you I get to meet. I get to do a podcast, some doc from wherever. I get to do a podcast and meet all my heroes and talk to them about life. It's amazing, amazing stuff.
It's a lovely answer to the
And I have to say,
question.
my wife, I'm blessed by my wife, dude. She's awesome. But seriously, like really a backbone, supporting me and everything, because we were going to take a financial hit, and we did, but it wasn't as bad as it could have been, and we're digging out. So you go, okay, like, but again, she said, you're miserable. What are you doing? And that was the other thing I'll just say. And she said, Brian, I noticed like you come, like she would ask me, how was your day? And I would always say, and I wasn't even thinking about it. Now I can put this into my talk because it's in my mind now. She would say, how was your day? I go, oh, it's brutal. I got yelled at by 4 people that were mad they couldn't get in sooner, and this and that. It was always like negative, always, And when I was in the room with the patient, I was positive, but the whole day is like, gosh, I treat you bad. You're stuck kind of dealing with people you don't want to deal with maybe, and stressful environment all day. And she said, how come when you come back from Guatemala, you're there working, like you're in the jungle working for 20 hours a day, seeing people doing all that stuff, and all you do is glow and you're excited and happy and you can't wait to tell me story after story. And I said, well, I think it's because that's what I'm called to do, not to deal with bureaucracy and try to beg insurance companies to give my patient the treatment they need or try to get the meds. I love that interaction with the patient. I just don't like what happens when I leave the exam room. And you have to deal with all the in Guatemala, I take all my meds with me, go, here you go if you need this, right? And I could educate people, and we could have a big conference and educate people on diabetes. I'm like, I'm doing something, I'm accomplishing something. But putting band-aids on and saying good luck, come back in 3 weeks, we'll see if we can take the band-aid and look under there, it's not good. It's not what we're called to do.
Yeah. What an amazing answer. This has been such a fun conversation, and one that I've been looking forward to for a very long time. I really meant it in the introduction when I put in there that you are one of the most beloved people in this space. Everybody has just the best things to say about you, and just to watch you interact, not only with bums like me, but other people at conferences, it is so genuine and real, and you are exactly the person you put yourself out to be. So it's just such an honor to host you here, and I've really enjoyed our time together. I know the listener will appreciate that as well. Where would you like people to go to find you and connect with you and your work?
Gosh, right now I'm trying to grow my Arizona practice, ArizonaMetabolichealth.com. On Twitter at Brian Lenzkes, BrianLenz as in zebra, KES. Those are the main places. You can obviously find us at Low Carb MD. We have Low Carb MD and Life's Best Medicine podcast. They each have their .com for that, and with all the old episodes, and that's probably the best way. And I just want to say to you, Casey, too, it's the same. Like, you're real, you're genuine. So many people in your space, and I love them. They're nice people, but they're so self-promoting, and they're so like a catchphrase, or they're trying to do stuff to, and you're yourself, and you're there, and you help people. I see how you interact with people at conferences and how you talk to people and stuff, and it's amazing. I think it's so important that you have that compassion, the caring. You want to help people genuinely. It's not about growing your business and being fighting with people on social media so that you get some extra followers, those kind of things. And I think that's why we're drawn to each other. I think that's really, really important for your listeners to know too, how fortunate they are to be following you and what you're doing.
That is very kind. I really appreciate that. I'm considering that very high praise coming from you. And you're right. Like, yes, it's important for all of us to make money doing what we're doing. We are professionals, but at the end of the day, it's not the biggest thing. It's to get this message out. So I really appreciate our time together. I'm very fortunate to consider you a friend. If you have any dirt on your wife, let me know before I interview her next week. If you've got something on the download you want me to bring out, you just let me know.
Yeah, that's why I was being nice to you, man, because I know you're interviewing her. She's stressing about it like crazy already, man. Like, she was supposed to do it this morning. We switched spots. Thank you for that, because I have a crazy week. But she's been stressing it. I'm like, I slept like a baby. She's like, "Are you nervous?" I kind of do this a lot. I think Casey's not going to try to drag me over the coals and stuff. So, but the problem is, like, you have editing rights on this one. Now, mine, I could edit her if she says something mean about me. I can edit out. But I
There you
think
go.
based on my past, I think we're okay.
Awesome. If anything comes up in the next week, you just let me know.
All
I will be
right.
sure to rake her over the coals. But again, Dr. Brian Lenzkes, thank you so very much for taking the time out of your very busy life to be on our show today. We really appreciate you.
Thanks, Casey. Appreciate it.
Thank you so much. And this has been another episode of Boundless Body Radio.